Hello everyone, I'm Janelle, and thanks for stopping by on my YouTube channel. Today we'll be discussing hypertension among African Americans. It is a quick lesson, so I hope it's educational for you and you'll enjoy it. Now that we have identified the topic of this lesson, at the end of this lesson, all viewers will be able to identify and understand the effect of hypertension among African Americans. This lesson has three objectives. The first objective is for all viewers to identify the factors contributing to hypertension among African Americans. We'll be covering general factors or influences, sensitivity to salt among African Americans, environmental factors, air pollution, economic inequality, access to unhealthy food or water. Objective number two, all viewers will be able to understand and communicate how hypertension affects African American population. We'll be looking over how certain medication help with African American compared to others. Objective number three, what lifestyle modification can help to treat hypertension among African American. We'll be able to cover diet and exercise and improve unhealthy lifestyle. So, at the end of this video, there will be a quick survey that will test the knowledge of how effective this video was. I hope you enjoyed this video. It will be lots of fun. Alright, before we go any further with this lesson, what is hypertension? And that is a question that a lot of my patients have asked me over time. And every time I would respond by saying hypertension is also known as high blood pressure. Yes, and it is very common again across all age and every race. However, African Americans are just more prone on getting hypertension. The older you are, the more likely you are of getting it. High blood pressure or hypertension is the force of blood against the wall of the arteries. And if your blood pressure is high, your heart tends to work a little harder than it should. Over time, it could cause damage to the arteries. Uncontrolled hypertension or high blood pressure make you more prone to heart disease, kidney failure, or even stroke. So it is very important that you follow up with your primary care provider or just to check your blood pressure on a daily basis. Don't forget to take your medication too. Hypertension or high blood pressure is also known as the silent killer, which means for years you'll have the condition and don't even know you'll have it. It can silently destroy the lung, heart, blood vessels, brain, and even kidney too. It is the #1 cause of stroke and heart attack in the US. High blood pressure is anything above the normal range, which is 120/80. So it is best and it is very important to check your blood pressure on a daily basis before taking your medication, of course. And of course, if you have a history or family history of hypertension. Hypertension are more common among African American. Research have suggested that the genetic makeup of African Americans make them more prone of developing the condition. African Americans tend to be more sensitive to salt, which increases their risk of developing the disease. African Americans are more prone of getting the condition at a younger age than anyone else due to their genetic makeup. Due to the genetic factors among African American, they are more sensitive to salt. So, it is very important to say no to sodium, or at least limit the amount of sodium in your diet. Just remember, where salt goes, water will follow. Therefore, if you intake a lot of sodium, you will more likely to retain water. And of course, the more fluid you have in your body, the harder your heart will work to pump all that blood around your body. Therefore, limit your sodium intake to at least 2,500 milligrams of sodium per day. So, your goal when you go at the store or supermarket, be sure to check the labels carefully for the sodium content. Stay away from packed goods or processed food. They are high in sodium, especially the canned soup and lunch meat. They are the prime suspect. Environmental factors play its role in individuals developing hypertension or high blood pressure. The more stressful your environment is, the more likely your blood pressure is to spike, which over time can cause you to develop high blood pressure or hypertension. If you are around smokers, the more likely you are in getting the condition. The unique experience faced by African Americans in the US put them at risk of developing high blood pressure or hypertension. Social and economic inequality. African Americans are more exposed or can afford processed food or canned food, which are notorious to be high in sodium. So, it is very important to pay attention to your environment. However, things that we can't control, like our economical struggles, it is at least our responsibility to limit the intake of sodium. So, pay attention to what you eat and your social and environmental factors. Air pollution is a contributing factor for hypertension or high blood pressure among African Americans. The long-term effects of air pollution, especially in the urban area, are chronic asthma, pulmonary insufficiency, cardiovascular diseases, and cardiovascular mortality. It is very important to stay away from air pollutant areas. Of course, air pollution causes strain on the blood vessels, which causes the heart to work harder than it should. Risk factors for developing hypertension among African Americans. Increased age. Remember, the older you are, the more likely you are of getting hypertension. Excessive weight. The bigger you are, or the more extra pounds that you have, your heart has to work harder than it should for pumping all that fluid around your body, which can cause strain on the heart and over time, hypertension. Family history of high blood pressure. If your mom has high blood pressure, your dad have high blood pressure, your aunts have high blood pressure, there's a family line of high blood pressure within your family, the more likely you are of developing the disease yourself. Having diabetes increases your chances of having high blood pressure. Inactivity. Remember, at least 30 minutes of activities during the day can decreases your chance of getting high blood pressure or control your blood pressure. High dietary intake of salt and fat. Remember, as we mentioned earlier, the more salt you intake, the more likely you are of retaining fluid. Water follows salt and fat. The more fat you intake, the more likely fat will be deposited on the internal surfaces of arteries or vein, can cause constriction of blood flow, which can cause your heart to work even harder than it should. Low intake of potassium. Potassium is very important. It is a vital electrolyte that causes your muscles to function efficiently. The low potassium, the more at risk you are of developing high blood pressure. Smoking. The more you smoke, the more your blood vessels constrict, which will cause your heart to pump or work harder than it should. Of course, stay away from smoking or stop smoking in itself. Medications used to treat hypertension among African Americans. Antihypertensive medications are used to treat hypertension. Anti means against, hypertensive mean hypertension. Therefore, antihypertensive mean going against high blood pressure. Therefore, lowering your blood pressure towards the normal range. Medication that your doctor may put you on are diuretics, which help to reduce the amount of fluid in your body by helping your body rid itself of extra sodium. Remember, where sodium goes, water will follow. ACE inhibitors, alpha blockers, channel blockers help to keep blood vessels from tightening up, therefore lowering the force of the blood against your blood vessels and preventing your heart from working harder than it should. Beta blockers prevent your body from making hormone adrenaline. Adrenaline is a stress hormone. It makes your heart beat faster and harder than it should. Therefore, it makes your blood vessel tighten. Using beta blockers help relieve the pressure from your blood vessels and also help relieve your blood pressure from going higher. It helps prevent your blood pressure from going higher than normal. A common side effect of taking antihypertensive medication is hypotension, which is low blood pressure. Antihypertensive medication can lower your blood pressure beyond the normal range, which can cause you to have a syncopal episodes. It is important for you to check your blood pressure prior to taking your antihypertensive medication. It is also important for you to have a daily record of what your blood pressure is so you can inform your primary care provider of your blood pressure readings. Lifestyle modification can help treat hypertension in African Americans. DASH stands for Dietary Approaches to Stop Hypertension. The DASH diet is a healthy eating plan designed to help treat or prevent high blood pressure among African Americans or any race. A DASH diet is rich in potassium, calcium, and magnesium. These nutrients help to control the blood pressure. However, the diet is limited or limit food high in sodium, saturated fat, and added sugar. The daily sodium intake when using a DASH diet is 2,300 milligrams of sodium per day. The diet allows servings of 2,000 calories per day. Lifestyle modifications that can help reduce hypertension. Reduce stress. Reducing stress in the environment can help prevent the spike in blood pressure. Exercise. At least 30 minutes of exercise is good enough to control or prevent hypertension. Light running, brisk walking, swimming, or any other activities that can help reduce blood pressure. Reduce salt intake. Stop or reduce alcohol intake. Stop or reduce caffeine intake. Stop smoking in general. Take medications as prescribed. And of course, try the DASH diet.